Yes, thank you. My name is Verhoeven. I'm a vascular surgeon originally from Belgium, but I worked for 15 years in the Netherlands, in Groningen, and am now since 13 years chief of the Department of Vascular and Endovascular Surgery in Nuremberg, Germany.
When did you arrive in Dubai for the conference?
I arrived late last night with about a 3 hours time difference.
Okay. What sessions and workshops are you participating in?
I'm actually having 3 presentations in 3 different sessions and 1 workshop. The presentations are about bridging stent grafts in complex EVA and TIVA. There is another presentation on post-dissection thoracoabdominal aortic aneurysms. A third presentation on the aorta, CLI, and the workshop is again on complex EVA and TIVA.
Okay. Out of all of those presentations that you will be giving or participating in, which one would you like to highlight to the delegates in the audience the most?
Difficult to say. I think I always like a workshop because you can be very interactive with attendees and talk with them and try to fulfill their questions, their needs, their requests. Regarding the presentations, I think bridging stent grafts at this moment are very hot in complex EVA and TIVA. And I think it's interesting to see that now several companies, including Bentley and Getinge, are providing us with additional options. Because I remember at the times 20 years ago where we really struggled to find a suitable covered stent for our fenestrated and branched procedures.
Okay. How does all of those presentations, how did those subjects impact the practice of interventional radiology?
Well, that's an interesting question. This is, of course, an interventional radiology meeting, and I'm a vascular surgeon, but I'm certainly a vascular surgeon who believes in 100% cooperation with interventional radiology. And our facility in Nuremberg is an example for that. We have a radiology meeting with both specialties every day to discuss every patient. And we decide together which treatment is best and who is going to do it. And we are not dogmatic. We can do interventional work as much as the radiologist can do endovascular work. And quite often when it gets more cumbersome, we cooperate and we work together. So I think my message is interventional radiologists and vascular surgeons should be in cooperation, should be good friends, should work together to treat the patients, because that will provide the assurance for all the patients that we are aiming for the highest quality, irrespective of who is treating the patients.
Have you participated in the PAIRS conference before?
No, and no is not completely correct, because last year I was not here, but I received an urgent phone call that I struggled with a live case because the graft had not been delivered. And then thanks to Bentley, who phoned me, I was able to help them and to do a live case with a 4 fenestrated graft. And I think, quite honestly, they were grateful for that. And maybe that is one of the reasons I'm here this year.
It's only day 1, not even a full day has passed yet, but how do you feel about the conference?
Well, it looks really absolutely excellent. I mean, first of all, flying to Dubai is not too difficult for us. It's a 6 hours flight. The hotel is very near to the airport, which is always a plus. The facilities are great. I saw the lecture halls and they are really beautiful. The exhibition looks nice. For us Europeans at this moment, the weather is perfect. So difficult to ask much more, quite honestly. And well attended, of course.
Do you see the educational material presented during the conference as being impactful to your interventional radiology or vascular practice?
Yes, and I think, quite honestly, it's always the same. You have the official part with the lectures and the discussions, but there is much more to that. There are discussions outside and in between the sessions. And those are the things where we can really interact, talk to the industry, talk with colleagues, make appointments, discuss further studies. And I think for me, that is a very important part of a conference, of any conference, quite honestly.
Have you had a chance to explore Dubai within the last night?
Well, no, the last night I was in bed and trying to get some sleep, quite honestly. But I've been to Dubai before, although quite honestly, it's most of the time a very short trip. It's either for operating, or doing a case, helping with a case, or doing a transition. So it's my first time that I'm here 4 days, and I look forward maybe tomorrow or the day after to have a quick look at Dubai too.
Okay, do you have anything specifically planned to do?
No, I came unspoiled, so to speak, and I'm first doing my job, of course, and then trying to have an additional view of Dubai.
Okay. And when are you leaving?
I'm leaving on Tuesday. Yes.
All right. Thank you so much.
You're very welcome. Thank you.